for sharing important information with us. I was hoping that one or more of you could speak to the interaction that taking stress doses of hydrocortisone have on your serum calcium levels. Our experience has been to take higher doses of hydrocortisone that Sam's calcium drops, and we have to compensate for that.
Do a calcium pressure.
I'm not aware of that, but the issue. So there are also potassium imbalances that can occur during an adrenal crisis, and that can affect calcium. So really low potassium can drop your calcium. If there's some vomiting going on, people can get low potassium from vomiting. So it may not be because of the hydrocortisone, might be because of vomiting.
We don't always
Right.
we don't always see that.
We have it as well.
Yeah.
A lot of people describe that.
We don't always see it, but we do see it, and as a result, when we have a kid that we have to put on, especially level 3, in the hospital, we're always monitoring it when they're in really high dose, and even if, usually not with a level 2, if they're not having severe, as you said, GI issues. But if they've got both hypopara and adrenal failure, you always have to follow that calcium. It's unfortunate. It's not easy. We're still not giving the actual hormone in most cases, and unfortunately, we'd like to, but we're not up in Canada, not yet, except exceptionally.
This might be silly.
This
might be silly, but can Solucortep last a little bit longer than the manufacturer's expiration date? Because thankfully we don't use it a lot, but we also go through a lot of vials that go bad.
Off the record, if it's expired and your child is having an adrenal crisis, I would use it.
Absolutely, absolutely. And then the other thing you can do is keep a couple of them as well, not just if you're not going to replace them, but if you have replaced it, and practice. Practice opening it up, setting it up, and use them as practice files.
And this is particularly important for our population because some people can now not get Solucortep.
Yeah, there's a worldwide shortage now.
I see your question is that.
So my daughter rides horses, and recently she had kind of a bad fall. It wasn't bad enough that she had to go to the hospital. Is there kind of like a gray or a hard and fast rule as to, because her trainer even said to me, should I give her that shot? I'm like, so she, she'll fall sometimes and she's but she gets back up and it's not a big deal, but.
It's not the pain of the fall. It would be if she hemorrhaged internally as a result of the fall. Okay, then she can have an adrenal crisis because of the volume depletion. So, I think just check your pulse. If it's fast and weak, I give it. I don't know if any other guidance for field management.
Well, I think the problem as an adult endocrinologist, I see that people take extra doses far too often, and then they develop Cushing-Reed stigmata. So they get adverse effects of this. Whenever they stress, they take some extra, whatever little thing they've done. So once again, I think the Achilles heel, as I said, that's when you get the gastrointestinal upset.
I have a question for Dr. Kämpe. So you said if stomach upset, it could lead to adrenal crisis, and sometimes I get it and it comes on really fast, and so I have the ondansetron if I get stomach upset, but that could just kind of mask what's going to come. So is there something should I take more steroids if I get a stomach up? Like if you see it, what should you do? And I'm still waiting.
Well, if it doesn't subside within 12 hours, as I said, then you should take extra cortisone by injection and go to the hospital. But you can be, if you have it repeatedly, try and have some, ice in your stomach.
What's your definition of a stomach upset? I just want to make sure I understand what you are feeling as symptoms.
When, usually if I get adrenal crisis, it comes on where I get, I'm not hungry, I get upset, like, I get nauseous, I get cold sweats, and then I'm like, and then I know within the next maybe 20 minutes, it's gonna go downhill fast.
Then you take it, absolutely. That, you know your body. And if you know you're going to end up in an adrenal crisis from previous experience with exactly that set of symptoms,
But
I would take
can
it.
can I just ask you, have you tried just to take some extra sodium chloride, salt,
Just like,
just like that? You don't need the tablet. I mean, the tablets are 0.5 grams. Just take some regular salt.
Yeah, pickle juice, can of soup, something like that.
And do you ever measure your sugar at that time? Do you ever measure what your blood sugar is?
I'm not sure how familiar you are with Cushing's from being on steroid overdose for a long time. But I've been like about a year now on a steroid overdose, and so I was wondering if you know how long it would take to reverse the effects of Cushing's, specifically weight-wise, but if you have any other input as to symptoms, I'd love to.
You know, it's highly variable, and, you know, there can be a withdrawal syndrome when you lower the dose, muscle aches and so on. You need to fight through that. I mean, it is highly variable.
Are you weaned yet down to a physiological dose?
I was on 5 in the first month. I was on 5 tablets of 5 milligrams a day, so 25 total. And then he lowered me to 10 milligrams a day, like that. So I was kind of nervous for like an initial adrenal crisis with such a drastic drop.
What steroid are we talking about?
Hydrocortisone.
Hydrocortisone, okay.
But also, we're working with Auchus as well, as of last night when I spoke to them, because I'm on budesonide for my liver, and so they said that apparently there is some sort of interaction, very like unknown, but it's right when I started the budesonide that the Cushing syndrome was like boom. I'm still on the budesonide.
I don't have any additional thing to say. I agree with Rich, you know, it's really individual,
Okay,
incredibly individual.
so it would take time,
It's
like
gonna take time, yeah.
if you're, okay.
So just real quickly, anyone speak at all to the shortage that we're having here in the states of hydrocortisone and solucortef? Like, is this, are we ever gonna?
Well, it's just solucorta, it's not the tablets, right? It's
Well, we're still having problems in Alabama getting the tablets.
We have had problems in Europe, similar problems,
And in
yes.
Canada.
And not only with these drugs, with a lot of cheap drugs. And I get the feeling sometimes that the pharmaceutical companies, they never have, there's never a lack of those really expensive drugs, but the cheap drugs for some reason. And I really don't understand why, because this never happened when I was a young doctor. Never ever.
What do we do about it? I think that's a more important question. The first thing I asked Pfizer and Lilly at our next Canadian meeting to run a special symposium to explain what the story is behind the drug shortages. How do they explain it? Why? Second thing that we're doing as physicians is we are immediately notifying our hospital pharmacies where our patients are seen. And we're asking the pharmacies to stockpile so that we get a priority distribution of our medications like diazoxide for our hyperinsulinemic, hypoglycemic patients, hydrocortisone, solucortef, etc. And you, the final thing, I think you have to write to FDA, any government people you can think of, just to tell them that it is abominable that these companies are not being able to come up with enough drug to satisfy these rare disease people when it's life-threatening. So we have to go at many levels to try and make sure we get the story, understand what's happening, protect our patients, and then change.
Okay, so
Yeah,
we have
better.
time for one last question. Susan?
My question is, I know, because I shared with you, Joseph, I got these too. I noticed that when I think he might be having a adrenal problem, I can't get up his blood sugar. Like he could take 10 glucose and he's still, for like 5 or 6 hours, still at like 70, you know, and it's very scary. So I was wondering, you mentioned, I know insulin is much more sensitive when your cortisol is low or your body needs cortisol, is that correct? Like, I might be kind of getting into an adrenal crisis if his blood sugar can't get up. So, I was wondering, rather than always taking him to the hospital, if I have little clues like that, what can I do other than just give salt? Because I know once he gets really dehydrated, I can't recover an outpatient, but how could I anticipate it enough to get him hydrated outpatient?
Well, I mean, you need to get glucose. And I tell my people to take sports drinks like Gatorade because it has sodium and glucose. And that they actually are co-transported by the same molecule in the gut. And so that's why I tell them is to drink sport, not the sugar-free one, the regular Powerade or Gatorade or, you know, whatever, you know. Yeah, which is completely irrational.
Thank you so much to